Hey there, welcome back to How to Medicate and welcome to this new video on how to use Nortriptyline. This video is part of a video series on mental health problems, and for those of you interested on learning more, check out the playlist in the description after watching this video, of course. For those of you who are meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewers, because I believe that medically educated people make healthier decisions, which is the whole point of this video and this entire channel. This video also comes with a disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, always contact your own doctor. And now quickly, let's get started. Now the generic name of this medication is Nortriptyline, but is sold under several brand names like Pamelor, Aventyl and Nortrilen, and it's available as a tablet. Now then, how can you use this medication? If you want to use it as a tablet, make sure to swallow it with half a glass of water. Furthermore, if Nortriptyline has no effects within 6 to 7 weeks of use, it probably won't be effective for you. Your prescribing doctor will most likely prescribe you another form of antidepressant. However, if you do experience benefits from the usage of Nortriptyline, then your doctor will probably keep prescribing it for 6 months up to several years. Nortriptyline itself is part of a group of drugs called Tricyclic antidepressants, TCAs, and they can be used to treat several mental health conditions like a depression, a bipolar disorder, and off-label it can be used to treat neuropathic pain and is used as an aid for smoking cessation. Normally I would discuss the correct dosage of Nortriptyline here. Unfortunately I can't do so because these dosages differ too much depending on your indication of use, the severity of your symptoms and the blood levels of Nortriptyline you would be having throughout your treatment. Therefore, always use the prescribed amount and frequency your doctor gave you. However, just to provide you with some broad guidelines, most doctors start off with a dose of 25 mg 2 to 3 times a day or 50 mg once a day. If needed, your doctor might gradually increase this dose up to a maximum of 150 mg once a day or 50 mg 2 to 3 times a day. Now, Nortriptyline is a very effective drug, but unfortunately it can have some side effects. I will discuss some of the most common ones in this video, but if you're looking for a complete list, always ask your doctor or check your leaflet. Very commonly it might cause a dry mouth, constipation, palpitations, dizziness or a headache. Commonly it can cause taste disturbances, confusion, weight gain, fatigue and erectile dysfunction. And uncommonly it can cause convulsions, high blood pressure, tongue edema, vomiting and nightmares. Which brings us to safety. First of all, do not combine Nortriptyline with alcohol, as this might increase its dazing effects. Secondly, do not drive when using Nortriptyline if you're experiencing dizziness, fatigue or confusion. This can be dangerous when driving. And lastly, Nortriptyline can have an interaction with other drugs you might be taking, therefore always discuss this with your prescribing doctor. And as always, we're ending these videos off by taking a look at the safety of Nortriptyline when pregnant or when breastfeeding. And unfortunately, it can be dangerous in both cases. Therefore, always discuss this with your prescribing doctor, as there are also a few exceptions. Now, I hope this video was helpful and I hope you know now how to use Nortriptyline. If you have any questions, let me know in the comment section and I will do my best to answer each and every one of them. All that rests me is to thank my sponsors on Patreon. Thank you Sebastian, who is an investor tier supporter, and thank all of you. If you did enjoy the video, please leave a like. This will help out the channel tremendously, and consider subscribing. I'm trying to reach 100,000 subscribers before the end of the year, and you can help me reach that goal. For those of you that can't get enough, I also made an Instagram account at How to Medicate. I'm posting there a few times a week, so check it out. And as always, I will see you next week with 2 new videos. Bye bye.